Hi, my name is Simon. I'm a doctor working in the Department of Infectious Diseases of the Hospital of Piacenza, Northern Italy. I've been dealing with COVID since the outbreak, which occurred in Italy on the 22nd of February. At the time, I was in Parma, actually, and I remember having the first two cases on a weekend shift. It was a Sunday, and I remember thinking how odd it was that we had two cases not being from China, but apparently they had been visiting the town of Codogno, which was, we didn't know at the time, but it was the epicenter of the outbreak that involved Italy, and right now is still raging in the northern part of Italy. Since then, a lot of things changed. The hospital in which I worked has turned in a COVID dedicated hospital, which means that every other department, which was not infectious diseases, has been somewhat turned into a sort of intensive care unit in order to support the patients that come inside with a severe pneumonia and are struggling for their lives, attached to oxygen delivering masks or oxygen delivering apparatuses of any kind. We are facing a very high mortality in the admitted patients, which is about 5 to 7%, mainly in those aged 60 or more, male patients aged 60 or more, with very few diseases. They are not they wouldn't be considered fragile patients because I don't know, they don't have cancer or they don't have severe diseases of any kind, but anyway they show rapid deterioration of the clinical conditions, and if they are not admitted in ICU for intubation and ventilation, they die in rather high proportion. Ever since the outbreak, the Italian government has been introducing several limitations to our personal liberty, which means that initially only in the affected regions we were not allowed to go to the gym, for example, or go to bars and restaurants. But as the situation rapidly escalated and more cases were present, we had to face even more severe limitations. And right now we are not allowed to get outside of our homes, if not for essential needs like gathering food or going to work. And also most of the productive industries have been shut down, which will result in probably in a major economic crisis. We are hanging on. We're doing our best to contain the outbreak, but as of now, cases are still high, and it is unlikely that in the next months we are ever going back to normal. We are resistant, and I wish to every people in the world, especially in those countries where COVID is spreading, I wish good luck, and I recommend everyone to stay home until your government says so, because your health system will be put into a severe stress. And staying home is the only way, aside from oral and nasal swabs, is the only way to prevent further spreading of the infection. Goodbye, and again, good luck to everyone.